Oversight Committee on State and Local Public Assistance Programs will come to order. Will the clerk please call the roll for today's attendance?
Chair Wolford.
Here.
Representatives Bruck.
Present.
Cara.
Here.
Cernoglu. Here. Menzer. Here. Chair Wolford, you have 5 members present. You do have a quorum.
Thank you. Representative Cara moves to adopt the minutes from October 30th, 2025 meeting. Hearing no objection, the minutes are adopted. Well, before we get started today, I want to take a moment and first say thank you to David Knezek, learning that you're a United States Marine and a sniper. That was pretty motivating. So look forward to hearing from you today. We know that you're the Chief Operating Officer at the Michigan Department of Health and Human Services. David, thank you for taking the time to be here voluntarily to have a discussion with us today. As many of you know, the recent federal findings around Michigan's SNAP program have raised serious and quite honestly alarming concerns. The state's error rate has climbed well above the national average for the second year in a row. And that kind of trend doesn't just signal a few mistakes. It points to a systemic problem that can allow waste, abuse, and even fraud to slip through the cracks. We know that this is a $3.2-ish billion business. And, when we look at nearly a 10% potential error rate in the for-profit world or normal company, that would send a business into 2 to 3 years of bankruptcy. And so I know this is something that we'll be working on and you'll be working on, and looking forward to hearing that. And so this committee obviously takes this very serious. SNAP is meant to be a lifeline for families who truly need help putting food on the table. But when oversight breaks down, and when the verification steps aren't being followed, and when the federal auditors start questioning our state's management, that hurts both our integrity and our program and the trust that taxpayers place in it. So our goal today isn't not to throw stones. It's to truly understand what's being done and what still needs to happen, and how the legislature can help ensure that every SNAP dollar is being spent properly. We want to make sure that Michigan gets this corrected and gets it corrected quickly, and that it will restore compliance with federal standards and rebuild confidence in the system, and also for the taxpayers that are funding these programs. So David, again, thank you. I almost called you Devil Dog, but that's all right. David, again, thank you for being here and for your leadership throughout what I know has obviously been a challenging situation. We look forward to hearing from you today on your perspective from your department and what the next steps are, and how we can truly work together to make sure that this program serves the people of Michigan in the way that it was designed to do. So with that said, carry on.
Thank you, sir. Good morning, first and foremost, to the chair, Representative Wolford, to our majority vice chair, Representative Bruck, and our minority vice chair, Representative Cernoglu, and all the members of the committee. I really appreciate the opportunity to be here, and then, of course, we'd be remiss if I didn't wish you a happy 250th birthday to a fellow Marine. Rob.
Era.
There you go. My name is David Knezek. I'm the Chief Operating Officer at the Michigan Department of Health and Human Services. In that capacity, I oversee a number of different areas and work streams within the department. One of those is what we call the Economic Stability Administration, and ESA for short, is where we oversee the processing of benefit applications for individuals across the state of Michigan. It's not just SNAP within that area. It could be Medicaid, it could be child care, it could be a number of different programs that our staff are asked to process in those spaces. And so appreciate the opportunity to come in today and talk about the efforts that DHHS is undertaking to address the SNAP error rate. My goal with the presentation is to just give a brief overview of SNAP, a little bit about how we got to this point and why we're here relative to the passage of H.R. 1, to give you a few examples of what those errors might look like, and then most importantly, to talk about the solutions that we're currently pursuing at the department. Of course, folks know at DHHS our mission is to provide services and administer programs to improve the health, safety, and prosperity of the residents of the state of Michigan. Is something we take very seriously, and under the leadership of Director Hertel, is something that we're driving towards every single day. The SNAP program, of course, we are committed to upholding the program integrity of that program. We want to make sure at all times that the processing that is being done by our employees is accurate. We want to make sure that it's timely, and then we want to make sure that we're holding ourselves accountable if and when there are errors, which is what we're gathered here to talk about today. As folks know, the Supplemental Nutrition Assistance Program helps put healthy food in reach for those in need, supports low-income families so they can supplement their grocery budget and they can afford the nutritious food that they need to thrive here in Michigan. Just a brief snapshot. Nationwide, we know that there's roughly 41 million individuals that receive SNAP support across the country. Here in the state of Michigan, you can see the numbers on the screen. I won't read them all verbatim for you, but whether it's children, individuals with a disability, older individuals across the state, we know that these payments are helping them make ends meet. And I think, I will call out, however, that last piece there that I think is really important to note, that 78% of the households that receive this assistance include somebody with earned income, meaning that they are working, that they are receiving income from an employer of some kind, and these benefits are simply used to supplement those needs. In terms of the economic impact of SNAP, we have over 9,700 retailers across the state who redeem these benefits. As you pointed out, Mr. Chair, $3.2 billion was the entirety of the program for fiscal year /24. On average, so we look at the number of individuals in a household, the number of days in a month, you're looking at $173 per month in the average benefit that's paid out to individuals across the state, roughly $5.68 per day. According to the reports that we have from USDA, every $1 that's spent on SNAP leads to $1.54 in economic impact, and then intuitively, as it relates to the community impact, when you have access to nutritious foods, when you have a healthy diet, we know that that reduces healthcare costs on the back end. Something I'm passionate about is the son of a lunch lady. When our kids are not in school and hungry, they're able to focus on their studies, and so we know it improves educational outcomes, and then, of course, supports our local jobs and economies. That includes, in particular, the agriculture and farming community, and then our grocery stores and retailers across the state of Michigan. I'll transition now into why we're here. As folks know, H.R. 1, also known as the One Big Beautiful Bill Act, was passed by Congress and signed by the President back in July. There were significant changes made to the Medicaid and the SNAP program, as well as the marketplace, that came out of H.R. 1, and that includes new conditions of eligibility, federal funding cuts that have a range of effective dates across the country. Specific to the SNAP benefits, I wanted to highlight what those changes looked like and what those dollar impacts might be for the state of Michigan. So as I stated earlier, $3.2 billion were paid out in fiscal year '24. This is the last year that we have complete year data. H.R. 1 imposed new cost-sharing requirements for states that had payment error rates between a range of values. And you can see on there, if you're running nearly perfect, 0 to 6% or lower, $0 cost share. That's obviously where we want to get as a state. If you're in that 6 to 7.9% bracket, it's a 5% cost share, so on and so forth. And then what I did there in that last slide under cost impact, just calculated it out for you so you could see with the $3.2 billion that Michigan pays out in SNAP, if we fall into any one of those four buckets, that's the corresponding cost impact that would hit the coffers here in the state. It's not included on this slide, but I'd also be remiss if I didn't point out that these changes to the cost sharing are one of what I think are three major pieces that changed coming out of H.R. 1. Yes, sir.
Just a quick comment. I want to thank you for putting this up, because when we first started talking about this, we had anyone and everyone talking about that this was a fallacy, that these were not numbers that we would potentially have to pay back. So thank you for your integrity on that this morning.
Yes, sir. Thank you. But in addition to these cost shares, we also had the elimination of what's known as SNAP Ed across the state of Michigan. So this was a $27.5 million annual investment, primarily administered through MSU Extension and the Michigan Fitness Foundation. 643,000 people were impacted on an annual basis by that, educating them about the importance of healthy and nutritious foods and healthy living. That $27.5 million was eliminated on October 1st of this year, and so that's no longer in existence. And then beginning next year, there's going to be a significant shift to the administrative cost sharing for the program of SNAP. So right now, we're operating under a 50-50 split as it relates to that administrative cost sharing. Starting next year, that will shift to 75-25, 75% borne by the state, 25% borne by the federal government. And that's regardless of what the error rate is. That's a simple administrative cost shift that's taking place. Based upon what the annual administrative costs are for the state of Michigan, that's going to be a $90 million increase to the state, simply from that 50-50 to 75-25 shift. All right, let's jump into the payment error rate and talk a little bit about the details and the nuance here. So the payment error rate calculation is a quality control process. It's a two-tier system done both here at the state level and also done at the federal level under USDA. We're simply reviewing to make sure that the accurate benefit is being paid out to households across the state. Every year, states review roughly 50,000 SNAP cases nationwide. USDA goes in and re-reviews about half of those cases just to make sure that the state is being held accountable and that our reporting is accurate as well. Here's what that process looks like. So in our local office, we have our specialists. They're processing applications. They're processing changes on a daily basis. That'll move up the chain to our management, who will do a re-review to make sure that what the information that was presented to our staff is accurate and being input accurately. Separately, within the department, we have our quality control area. So we don't have individuals that are reviewing these cases that are also a part of the same administration. It's a separate administration under our Financial Operations Administration, that quality control team that are assessing these cases against the federal guidelines, that are picking up the phone, calling these beneficiaries directly, and verifying the information that was presented to the state. And then, like I said earlier, FNS reviews that work that's done by our quality control team just to confirm accuracy. We're required every year to submit to FNS. FNS is the Food and Nutrition Service, part of USDA. We're required to submit to them on a yearly basis what that sampling plan is going to look like. So you take a randomized subset of all the beneficiaries across the state, you review those cases, and you determine if the payments were accurate, over, or under. So here in the state of Michigan, our approved plan with FNS has us reviewing about 1,100 active food assistance program cases every year, as well as 720-ish negative cases. When I say negative cases, I mean cases that we determined we could not process fully, and so we didn't. Cases that we took a negative action against, and so we ended your benefit, and they review whether or not we ended it accurately or not as well. And so they review those, FNS, like I said, review those dropped reviews. They do that random selection. One of the pieces that does contribute to the error rate that I find to be frustrating is that when we're going through that quality control process, like I said, the cases are randomly sampled. Our QC and staff pick up the phone, they call the beneficiaries. That beneficiary may answer the phone, they may not. They may want to participate in that verification process, they may not. If QC believes that there's an error, and that error could be resolved by having a conversation with the beneficiary, but that beneficiary does not want to participate in that review process, it still counts against us. That conversation could resolve all of that issue. It could ensure that things were done appropriately and accurately, but if they don't want to participate, it still counts against the state's error. And so I find that to be frustrating. And then, like I say on the right-hand side of the screen here, if QC identifies errors that were made, whether it be overpayments or underpayments, we don't just say, okay, keep moving along. We hit the pause button, we go back, we work with our staff, and we take corrective and remedial action to ensure that those underpayments or overpayments are corrected. I think I can fly through this. I think I've covered it mostly in my previous comments about the sampling plan, the random samples, et cetera, and then the FNS audits. The formula itself is relatively straightforward. It's a formula that's set by the federal government. It's a combination, and I think this is a key piece here, of household errors and state errors. By that we mean errors that are made by our beneficiaries, as well as errors that are made by our staff at the department. And so to calculate that error rate, you take the overpayment, You take the underpayment, you total those two items together, you divide it by the total amount issued within that sample size, and that gives you your payment error rate. The payment error rate, I think it's also important to point out too, is not a measure of fraud. I know that there was our Inspector General who came in here and gave this committee a presentation about all the fraud steps that we take to ensure that we're ensuring program fidelity. The payment error rate does not measure any of that work that's done by the OIG, and so whether it's benefit tracking, the EBT card fraud that we've talked about in the past, retailer fraud, et cetera, that does not go into the payment error rate. And because I talk about EBT card fraud, I'd also like to take the opportunity to thank the legislature for the investment that was made this year. I know it was a $16 million investment. We're going to begin by January 1st of this year the process of transitioning all of the EBT cards here in Michigan to chipped cards. And so I thank you for that investment, and I appreciate that. Again, household errors, state errors, I think I might be able to fly through this piece too. The key point being that if you have that payment error rate higher than 6%, it puts us at risk of sanctions imposed by FNS. This risk of sanctions has been in existence even prior to the existence of H.R. 1. Now, though, we have that financial penalty that's associated with it at an even greater magnitude than what we've seen in the past. I must respectfully disagree with what you said in the beginning, Mr. Chair. Michigan is ahead of the national average as it relates to our payment error rate. There are 6 states across the country that are below that 6% threshold. We hope to obviously be one of them here in the coming months. We pulled a sample of other states that issue roughly the same amount of benefit issuance as Michigan and do the same type of work. You'll see that in these states, the payment error rate has been rising over fiscal year 23 to 24. Michigan, on the other hand, is trending in a downward direction. I'll show you that slide and even further build out of that on the next slide. One of the pieces that I'm always cautious to point out to folks is that it might be tempting to look at a state that has a low payment error rate and then say to yourself, why don't we just do what that state does? Let's not reinvent the wheel. Let's drag and drop the good things that they do. Wisconsin is the example that I like to use. Wisconsin has a relatively low error rate. And so we actually took our staff and we sent them out to Wisconsin in the last year and said, let's work collaboratively. We're all in the same boat here in terms of having to reach this goal. Go and figure out what they're doing that works. Wisconsin, however, is a decentralized state, and so it's all being done at the county level. It's not being done at the state level like we have here in the state of Michigan. And then when you get into the specifics of what it is that Wisconsin is processing, that's where you find that huge gap between their state and ours. So as I sit here and talk to you about food assistance and payment error rates, when you go into our local offices and you meet with our staff who are processing these applications, it is not just food applications that they're processing. The same individuals that we expect to be experts on food policy also have to be experts on Medicaid policy and that processing, also have to be experts on state emergency relief and that processing, child care, et cetera. And so we do ask a tremendous amount of our staff. I'd be remiss if I didn't acknowledge my deep appreciation and respect for all of our employees across the state and the work that they do. As we've begun this effort to reduce the payment error rate, I have seen nothing but sort of an all-hands-on-deck approach from our staff. Everybody's motivated by it. They're excited to see the investments from the legislature, and they're eager to reach the goal that we all share. This here tracks Michigan's payment error rate over the last 5 years. I spent a good amount of time with my staff trying to ask what the heck happened in FY22. Why did we see that pop up? In some cases, it might be you have just one extreme outlier of a case that really drives up that payment error rate. We were not able to identify any one specific thing that we could pinpoint for fiscal year 22. What I am pleased to see, though, however, is that we were immediately able to get back on the horse and drive that payment error rate down. And so we see that downward trajectory over the last few years. I would expect to see that downward trajectory continue in the months and years to come. You may be asking yourself, we're sitting here in November of 2025, David, where's the FY25 years? We do not get final numbers relative to the payment error rates from FNS until June of the subsequent year. And so I will not know what our payment error rate is for fiscal year 25 until June of 2026. So I just wanted to make folks aware of that gap. I want to talk a little bit about the root cause data. So when we started this effort specific to HR 1. We did an intensive 5-week examination of the payments, the errors, where they're occurring, what is driving them. When you have limited resources, you have to be surgical and thoughtful about how you're deploying them across the state. And what we found is consistently the 4 data markers that you're seeing on the screen here, this is where the overwhelming majority of our payment error rates are coming from. On the earned income side, it could be new income that you're receiving within your household. It could be changes in your hours and your rate of pay, and I can get into some more of those specifics here lately. On the deduction side, the calculations of your mortgage, your property taxes, house insurance, et cetera. I can talk about that more here shortly as well. Even down to the number of members that you have in your household and who is grouped within that household size for the purpose of calculating your benefit. And then your unearned income, contributions that you might get from folks outside of the group. And we're going to jump into a couple examples here that demonstrate for you how some things that maybe appear to be intuitive might not be, and then there's no shortage of regulations that accompany them that we have to sift through as we make our determinations. So here's one example on the household side of things. And these are real examples. They're not made up just to try and make a point. These are actual examples that we pulled from our QC team. So this individual went through a redetermination of October of 23, stated that she lived with her stepdaughter. A year later, moved in with her adult daughter and another unrelated person. They stated that they all purchase their food separately. They prepare their food separately. They believe that they are in a separate FAP grouping. If you're under the age of 22, however, regardless of the circumstances, you're supposed to be on your parents' or the head of household's group size there. And so when our QC went out there and had the conversation with the client, confirmed the age of her daughter, was supposed to be a part of that mandatory group, and so that daughter's income should have been part of the calculations that determined the benefit that received by that household. That did not happen. That resulted in the error. And if you want me to get into just a sort of 40,000 foot of how we do the calculation of those benefits, and how some of the actions that we've seen out of the federal government in the last few weeks sound one way, but in reality play out to be another, I'd be happy to get into that too, but I don't want to detract from this conversation. On the earned income side of things, we're looking at a family of 4 that was redetermined in August of last year. They reported that they had no income. Fortunately, the head of the household was able to find employment just a month later. Their spouse was able to find employment a month after that. That new income was not reported in a timely fashion. When QC went to review, however, they were able to verify that earned income with the individual. So what I would posit to this group is that if you are unemployed and you're struggling to make ends meet, when you're receiving FAP benefits and you finally land that job, the first thing that you think of is not, man, I'd really better call DHHS right now to make sure that they know I got this job. You're happy you got the job. You're focused on going to work. You're focused on providing for your family. However, the rules state that if you have changes in your income, if you have changes in your employment, you have 10 days to report those changes to DHHS. DHHS then has 10 days to process those benefit changes, and your income should be, your benefit should be adjusted up and down accordingly. When QC will go through and do their review months later, at that time, of course, the individual has achieved some level of stability. Perhaps they're thinking about it differently than they were in real time within that 10-day window that they have to report to us, and so they report different information to QC. And again, if those errors are identified, we still go back and we correct the error, but it still counts against our error rate. On the unearned income, earned income side of things here, an individual that was determined in May of this year told us that she was living off of her savings. We had her report to QC, however, months later that she is living off her savings. However, her husband gives her $1,650 a month to pay for rent. So we pick up the phone, we call the husband, we verify that information. It's different from what was reported to us in the beginning, and so that individual is receiving the wrong level of benefits. If that money was being paid directly to the landlord, that would have been a different scenario. But because it was being paid directly to the individual receiving benefits, it then counts as unearned income and resulted in an error. And here on the expenses side of things, clients reporting to us that they're paying their mortgage, they're presenting their mortgage documentation to us, they're sending in their documentation around their summer property taxes, they're talking about their monthly expenses. What they reported to our quality control, however, is that some of those things are built into one another. Those mortgage payments are inclusive of the taxes and insurance that are being held in escrow. When it was presented to us, they were two separate documents. They were double counted, and so again, resulted in an erroneous level of benefits being paid out and resulted in an error. I believe this is the last one here. Around the rent and expenses that the individual's receiving, what they're budgeting, the shelter expense that they're applying and sharing with DHHS. When we're able to go off and run some of our background checks to ensure that things are being processed accurately, we identified a discrepancy in what their reported rent was versus what it actually was, results in an error, and counts against the state. The application itself, and this has come up, I know, a few times, and so I wanted to spend some time just talking about this as well. The federal government states to us, what are the minimums that you have to accept in order to accept an application? And I cited the CFR there for everybody that talks about as long as it contains the name and the address and the signature of a household, responsible household member, they have a right to immediately file that application with DHHS. That does not mean, however, that they immediately have a right to receive benefits paid out to them. And so there's a difference between accepting an application and processing an application. I can accept an application with the bare minimum possible, but I cannot pay out benefits unless we go through that process of determining accuracy and ensuring that an individual's information is presented to us accurately. And so I just wanted to spend some time pointing out the nuance there as well. On the SNAP side of things, we've got two different types of SNAP benefits. We've got your standard 30-day process benefits. When that application comes into us, we have 30 days to process it. As I said most recently, we can accept that application. We still have to go through the process of ensuring that the information presented to us is accurate. And so you can apply through our online portal, My Bridges. You can apply through a paper application. We must conduct an interview with every single FAP beneficiary. And so whether it's an in-person interview at one of our 90-plus offices across the state or a phone interview that we do with individuals, we have to have that contact with them to ensure that the information we're receiving is accurate and timely. We can do inquiries of the individual. We can also run inquiries through a number of data connections that we have on the back end. So whether it's their Social Security, their citizenship, any unearned income they might have, we can run those inquiries. We can go through the verification and validation process with the beneficiary on their income, their self-employment, and their expenses. And then within 30 days, we have to issue a determination as to the number of benefits that they receive. However, we also have something that's known as an expedited application. Much of it looks the same in terms of how we receive things, the interviews that have to take place, the verification of their identity, certification has to take place within 7 days. You qualify for an expedited FAP processing if you've got less than $150 in monthly gross income or less than $100 in liquid assets. And so in those circumstances where an individual might truly have nothing, time is of the essence. We need to move quickly. We have a 7-day turnaround time that's associated with the processing of those benefits. And then again, if those verifications are not received or returned, then we would turn off their benefits. I'm going to transition now into the process that we've undertaken since the passage of HR to get us to where we want to be. And I think it's important to point out, we didn't just wake up on July 5th and say, oh gosh, we should probably start doing something about this. What the initiative that we're undertaking now is truly building off of and scaffolding off of work that we've been doing consistently over the last decade. But I think it's going to allow us to really take it to the next level. One of the things that we started in January of this year, even before the passage of HR 1 was going through and identifying the policy areas within our department that contribute the most to the payment error rates, redoing those policies, reformatting those policies, making them as clear and concise and easy to process as possible. And so we wanted to, like I said, take it to the next level. We conducted a 5-week diagnostic to go off and confirm all of the different types of errors that we're seeing and that are contributing to the SNAP's payment error rate. I think that's important because if you've got an error, as we do, and I'll talk about here shortly, that's driving 50% of the errors, I really want to double and triple down on that effort. If I've got an error that's driving 0.5%, 0.2% of the error, and time is of the essence. That's probably not where we want to spend our money. And so we had the targeted list of root causes that were developed. We worked with our staff and others to identify potential initiatives that we could enact here in a short order, tested those initiatives, prioritized those through our workshops that we conducted with external and internal partners. And of that, we identified 8 initiatives that we are actively pursuing right now, 35 different work streams, however, within those initiatives to try and drive down that error rate. I want to spend a little time talking about the 7 variables that we identified in terms of driving those error rates. The first one being the types of payment error. What we found through our research is that of the error categories that QC looks at, 10 of those categories account for 95% of the errors that we're seeing across the state. Wages and salaries and household composition, the 2 things I've talked about already, contribute to roughly 50% of the error rate. And so if we're able to tackle those in a deep and meaningful way, I expect to see a good ROI on that investment. Secondly, the streams of errors. When I talk about streams of errors, I'm talking about, is it a client error or is it a DHHS error? Where in the process is that happening? Is it on initial application? Is it at redetermination? Is it with an online application? Is it with a paper application? Really drilling down on the specifics so that we can be targeted with the deployment of our interventions. The point in process where that SNAP payment error occurred, I just spoke about that accidentally in terms of, is it at initial application or redetermination? The source of the SNAP error. So when we worked with QC, we were able to identify where in the case record, where in the interview process specifically, we identify those errors so that we can, again, drill down on remediation there as well. The SNAP payment error county. We've got 83 counties across the state of Michigan, as you all well know. Not all of them are contributing to the payment error rate in the same way. And so of the 94 local offices that we have in Michigan, 32 of those offices accounted for nearly all of the error rates that we found within the state. It may be no surprise that it's also correlated with those that have the highest population density within the state. And so as we go about this process of thoughtfully deploying how we want to provide interventions here, you should not expect to see a broad brush statewide approach. We really want to be granular and deploy those resources and those supports where we know the need is the greatest and where the risk is the greatest as well. On the workforce capability side of things, specialist characteristics, et cetera, we looked at FTEs, we looked at caseload, we looked at error rates, the turnover rates, to try and identify where we can have some interventions as well, and then as well the client characteristics. So looking at the metrics of those clients who might have a higher or an overrepresented sample in the error size. So it might be tempting, for example, that the largest number, gross number of errors come from 1- and 2-person households. So it might be tempting to run down that route in terms of your interventions. It's simply because the 1- and 2-person households are the largest number of beneficiary group sizes. The risk for the errors increase exponentially as the group size goes up, because as the group size goes up, the amount of benefit goes up with it. The potential for error against a larger dollar value goes up as well. And so we wanted to be thoughtful about where and why and how we're deploying those resources. Once we identified all of that information and a quantitative analysis of where we need to deploy, we began the process of engaging with our staff members. Again, when you're going through an effort that is going to require buy-in and support from the thousands of employees that we have across the state, the change management component of that to me is critical. I want folks to understand the why behind what we're doing. I want them to understand the role that they play in it. And so we tried to be intentional and thoughtful about going all across the state, visiting with our different business service centers. When I say business service center, think of a grouping of county offices, so really a regional office. Meeting with their focus groups, meeting with the specialists who are doing the processing, meeting with the supervisors, one-on-one interviews with our leadership team, one-on-one interviews with our county directors, and then also meeting with the QC team. I think there's a great opportunity for us to improve the coordination and collaboration between the individuals who are doing those follow-up reviews and the individuals who are doing those initial processing and applications to make sure that we're in alignment with one another as well. And so here, this slide here, I spoke about the 8 immediate initiatives that we are undertaking right now. This is what the slide before you speaks to. Recall, though, that these 8 initiatives include 30-plus different work streams. And so this is not the be-all, end-all of everything. I'll give you an example when we get down to the technology side of things. But first and foremost, what we are doing to try and drive down that payment error rate. Number one, looking at the information submission process that we have from our clients. What are we doing to simplify and clarify that process? How can we improve their understanding of what it is that we need from them? How can we streamline that process, whether it be online, through your phone, on the computer, in an office to submit that application? And then also, what are we doing to proactively improve the communication that we do with clients to ensure that they're prepared along the way? Second is the client interview support. I talked a little bit about what we're doing and have been doing proactively for the past few months prior to HR1 to make sure that those that are doing the processing have all the tools that they need at their fingertips, a list of must-ask questions to ensure that we're capturing all of the nuance that's there. If you were to ask somebody, give me your rent, and they said it's $500, and you moved on to the next question, within that $500, there might be a $50 pet fee. There might be some other utility that's included in there. Those things are not used or appropriate to be calculated in that final benefit issuance. And so trying to be more granular and specific and thoughtful about the questions, supporting our beneficiaries by way of our specialists doing the appropriate question asking, we think is going to be a key to success here. Third, the policy resource simplification standardization. I spoke about that already. This is an incredibly onerous process where we get the CFRs from the federal government. We have the policies that we adopt here in the state of Michigan. They are, I think, very legalese and perhaps difficult for an individual to look at and process clearly and quickly. And so if you want to change your policies, however, you have to go back to the federal government. You have to ask for their permission and approval to change any of the policies that you have on the state side. And so we've worked on building out what supplemental resources we can provide, examples and supports that we can provide to simplify the policies and their interpretation across the state. Fourth, our staff deployment strategy. Folks may know or understand that Michigan operates in what's called a universal caseload model. That's probably a whole nother hour worth of committee that we could jump into if you want to have me come back for that. But looking at how we do the workload distribution, where I have those quote-unquote easier cases or more straightforward cases, one-person household, steady income, et cetera, how are we assigning those to employees that are maybe a month or two on the job versus have been doing it for 10 or 12 or 13 years? With UCL, it gives us that flexibility to deploy those cases to individuals that I believe are best positioned to process the most complex and timely cases to ensure that we end with accurate cases as well. And then fifth, very similar to that, accuracy-focused UCL updates. Within UCL, we track on a number of metrics on a daily basis, a monthly basis, to ensure that our staff are achieving or meeting the expectations that we have set for them. One of the things that we're looking at building in is credits that you receive as an employee. And when I say credits, I should be clear. It's not a monetary credit. It's you get a calculation done every day. If you process this amount of applications, this many redeterminations, it all builds towards ensuring that you met your metrics for the day. Building in metrics that say you might be farther upstream in that processing. If you catch the error that somebody beneath you or before you made, that's going to get recognized, that's going to get supported, and that's going to count towards the metrics that you have to meet for the day. So trying to incentivize the staff to drill down and make sure that they're capturing errors amongst their peers so that it doesn't even have to get to the point of review from somebody else. Again, on the upstream error correction piece, redesigning that pre-certification and quality assistance process to ensure that we catch errors in real time. My personal opinion, if we are solely reliant on catching the errors downstream, worst case scenario, having those errors caught by QC, we're missing an opportunity to do it sooner, to do it faster, and frankly, to deploy tools that are available across the country right now to ensure that those reads are done quickly, AI, I think, presents an incredible opportunity for us to build into this process. Everything as simple as when you're, the rep knows, sometimes I use like the military phrase and acronym from time to time, but like if you're hand jamming that application and the person's saying to you, I've got $450 in income, and you're looking at that keypad and the finger hits the 7 instead of the 4, that's going to result in an error because there's a erroneous input of their income. But if we're using AI tools that are able to do that optical review of the information that's being presented to us, populating that within the system, removing that opportunity for operator error, it's going to increase the accuracy that we have as well. The Bridges systems updates, there are 10 that we are looking at doing immediately right now to our Bridges and My Bridges system. There are 30 that we have identified throughout that diagnostic process that I spoke of earlier. When I talk about the staff being excited about the work that we're doing and the investment that the legislature is making, a lot of that comes around the policy side of things, a lot of that comes around the process, a lot of it comes around the Bridges side of things. Bridges is a system that, a lot of money was spent on it on the development side of things. Once you've developed a large-scale platform like Bridges and My Bridges, you transition into the what we call M&O, maintenance and operation phase of things. Yes, sir.
If you could just maybe wrap up that next slide in the next 3 minutes so we can get to questions.
You got it.
Thank you.
I appreciate the break. I needed some water.
Yeah.
And so the investments that we're going to see now from the legislature, the $30 million investment that was done this year, that's going to empower us to go off and make these Bridges enhancements that we have been hoping to do, wanting to do, looking to do for years now, just never had the resources to do it because we were in that M&O state. And then finally, looking at different waivers that we can explore with the federal government to ensure that that error rate comes down. I won't jump into this. I know it's super detailed, but what I wanted folks to see, you'll see on the x-axis there, those items that I just walked you through in terms of what the initiatives are we're undertaking to lower that error rate, and then on the y-axis, how they measure up against or how they impact and touch the predominant drivers on the client error side and the caseworker side. And then finally here, just our guiding principles for where we're trying to take the team and how we want to move forward, maintaining that focus on the SNAP payment error rate. What are the quick wins that we can get under our belt and keep building towards more large-scale implementation in the months ahead? How are we going to clearly and consistently communicate with our staff as well as our beneficiaries, continuing to engage our local office in the co-creation of solutions? I do not believe that I have all the answers. I'm one person. I have a phenomenal team of experts that I rely on heavily, and I believe that this process should be co-created with them as well as the beneficiaries that we serve, and then, of course, tracking with transparency. So in the interest of time, Rep, I'll stop there, and I'm happy to take any questions you have.
Thank you. Appreciate it. I appreciate your thoroughness, and I was thinking, and most won't get this, but I find it ironic that we snap in the Marine Corps, and you're in charge of SNAP. But anyhow,
Yeah.
For those that are listening, when you're qualifying with your rifle, it's one of the things that it's an acronym, I guess, that we use. So anyhow, thank you for that. I appreciate you. A couple of questions that I have is, in a prior presentation about SNAP error rates, it was pointed out that while error rates are publicly reported once a year, your department should have access to these metrics at least on a monthly basis. So meaning MDHHS should be ahead of the curve on lowering an error rate rather than waiting until that following next year, or as you mentioned, getting results from the federal government in June. So what sort of metrics do you keep track of internally, or can you do to stay ahead of that curve? And I say, I know that in 2020, we were at almost 14%. 2021, it was 10.79, and then in 2022, it went up to 13%, and you talked about that. So while I like seeing the error rate go down, I'm concerned that there could be another dip and maybe looking at this on a monthly. So could you speak to that, please?
Yeah, like I said, when that monthly sample is done from QC, they'll pick a county, part of the state, whatever it may be. They'll do that random sampling of the cases. They'll go through and they'll determine what was done right, what was done wrong, overpayment, underpayment, et cetera. They're then able to report that directly back to us. and so that we can go and remediate that issue in real time. In terms of decision-making, though, and driving what the interventions are going to be, I think one of the things that is hamstrung with that process is that you might be taking one case from Charlevoix County or whatever it may be. It's never going to be a statistically valid sample size from that one county in that 1 month. And so drawing conclusions from that, I think, would be ill-advised. But when we're able to look across the depth and the breadth of the work that's being done across the state, and then, of course, as you go month over month and that data set grows, as the N grows, it becomes more refined, and we're able to refine those interventions. And so what we do on a monthly and rolling basis already is if we're starting to see across the state within this specific policy, within our policy manual or policy guide, we're starting to see the errors related to that specific policy tick up, we will call meetings with our staff. We'll go through remediation and training on that specific policy. We'll give examples of how things should be done accurately and deployed accurately. So we don't wait until the end of the year or the year plus we hear from FNS to do those interventions. To the extent that we can and to the best of our ability in real time, we're tracking on it and we're providing that feedback and those wraparounds, if you will, to our staff. I don't know if that answers your question or not, Rep.
And in regards to that, do you only sample households in a certain region, or is it random samples across the state?
It's a completely randomized sample across the state.
Okay. And did you mention that there's a certain amount of counties where we continuously see fraud? So would it make more sense that we look at those areas more than maybe randomly sampling a place that there's less fraud?
I would respectfully push back on the use of the word fraud, only because we're talking about payment error
Or
rates.
error rate. Yeah, I'm sorry.
We're all in now.
It could
We're
be
all in
fraud,
now.
it could be waste, it could be fat fingering.
Sure.
And by the way, I do have to say, I've heard this operating error and fat fingering, and I heard it from Director Hertel as well. And I have such an issue with that, because if you could imagine a banking system, you think our banks could get away with saying, I'm sorry that your account is plus or minus because my employees fat-fingered something. So I hope that we get a different fix, a different talk track for that, because it's bothersome to me. But anyway, thank you for correcting me.
I'll give you a response
on
to
the
that
front.
if you'd like, yeah.
Yeah.
So first and foremost, the short answer is yes. Where we've been able to go through and identify the counties and the offices that have those higher error rates, we're going to be able to focus and target our efforts on those counties. And I say that because I don't want folks to think or feel like, if Schoolcraft County is not getting the same level of attention that Wayne County is, it's not because we're not taking it seriously or what have you. It's because we have a significantly larger number of beneficiaries in Wayne County, and so the risk would be larger there as well. And with limited time and resources, we want to make sure we're being thoughtful there. I think your banking example is actually a really good one, Rep, and I would love to get away from the point where we explain to folks this concept of fat fingering. What the banks also have too, when you're filling out those bank statements, you're going and providing things to them, they have that optical character recognition technology. We want that within our programming. And one of the technology enhancements that I spoke of earlier, the 10 different prioritized enhancements that we're looking at doing right now, one of those is that character recognition technology. So in a perfect world, it gets away from that fat fingering example, for lack of a better term, and allows the AI or the data or the system to do the character recognition and the inputs so that across the board, everything's input correctly.
I'm even surprised in the politically correct world that we live in, we can call something fat finger. But anyway, thank you for the explanation. And another question is, are there any times of the year that an error rate is generally higher, for example, during holidays?
You're absolutely right. Yeah, as we see things over the course of time, we know as we get ready to head into December and January here that we're going to see that tick up. And then subsequent to that, you'll see error months where they're much, much lower than that. And so if you were to just do sort of a snapshot point in time in December and January, you might say, oh gosh, what direction are we headed in right now? But then because things are so significantly lower in the months after that, it pulls that error rate back down to what the end of the year piece is. So one of the pieces we talked about when I was talking about staff deployment, resource deployment, et cetera, and I know we have our Economic Stability Administration senior deputy behind me here, we've already begun those conversations about as we're heading into Thanksgiving, Christmas, New Year, et cetera, We know what's coming. What are we doing proactively to get ready for it to prevent that error rate from taking that spike?
Great, thank you. Representative Cara?
Thank you, Mr. Chair, and thank you, Mr. Knezek, for being here today. On the AI you were talking about earlier, it certainly can be used to speed up processes. I understand that, but would we be using zero-knowledge AI to where the data source doesn't get all that information from the people, or what would you recommend?
Rep, I'm not familiar with the phrase that you just shared. However, I'm happy to go back to our tech vendors and make sure that there's a level of comfort around I understand what you're asking, and
Yeah,
and
basically
happy to.
use the AI to do the work, but then don't gather that information from the people to give it back to the data source.
Sure. Yeah,
Okay.
I'm happy to go back on that.
Okay, and what is Michigan's recertification period for SNAP benefits?
So when you apply for SNAP, you get redetermined every 12 months, but there's also a mid-year certification that gets sent out to those individuals as well. So formally 12 months, informally every 6. One of the things that we've just started doing in October was on a monthly basis, sending out those text messages, sending out those reminders directly to the beneficiaries. Did you get a new job this month? Did your income change? Is there somebody new in your house? If we need them to report that stuff to us, we're now trying to push that reminder to them in a way that we think is going to get the information to us quicker so that we can process more accurately.
And the quality control that is done, that is a sample of what percentage? Is that around 1%, 30%? How many people are being audited to make sure that if they got a job that we see how that might impact their benefits?
I'm going to go back up here. So the QC sample size that's done on an annual basis, it's 1,100 active FAP cases and 726 negative cases. I think there's about 600,000+ households that receive SNAP across the state.
So the vast majority are not having quality control investigating to see if there has been a change in their income?
The department has submitted its annual QC proposal to the feds. It's in alignment with the feds' expectations. It's the same way across every state in the country.
And that's the USDA who requires you to do that, correct?
That's my understanding, yes.
All right, thank you.
Thank you, sir.
Representative Bruck?
Thank you, Mr. Chair. Thank you, Mr. Knezek, for
God
being
bless you.
here.
Thank you.
Appreciate it. Bluff, we'll put the bluff up there. The error rate. We're talking error, not necessarily fraud, but sometimes we talk fraud, which could be an error, not an error, or vice versa. What is your end state goal with your error rate?
Well, I think the end goal is to be under the 6% threshold that the federal government has set. Our goal is always going to be the same: accuracy, timeliness, and accountability, ensuring that people receive the benefits that they're eligible for and that they receive them in a timely fashion.
And you stated that 50% of the errors are income-related or household composition. And you gave one of the examples, I think it's the third example, someone had unearned income. They're being paid rent money, but they didn't claim that, and then months later, an error occurs, and you find out you fixed the problem. What happens at that point?
So if an error is discovered through the QC process, they will report that error back to our service specialists, the individuals that are processing the application, and they will go through and they'll correct that error. And so if there was an under-issuance of benefits, we would make sure that the next issuance of their benefits includes the difference between what they received and what they should have paid. If there was an over-issuance of benefits, we would take off that over-issuance from their subsequent benefits. So I'll just use made-up numbers. If you get $150 a month in food benefits, but we determine through the QC process that you're supposed to only be receiving $100 a month, that $50 difference, in your next month benefit, you're going to get $50 because it's what you should have received minus what you were overpaid, so that over the balance of the months that we're looking at, the numbers are accurate.
Okay, and if that individual received no more benefits, they would get a bill then?
Potentially,
their income was to a level where,
Sure.
okay, you no longer qualified, nor did you qualify the previous 3 months.
Yeah, no, it's a great question. So if there is no sort of recoupment mechanism by way of your benefits that are still going out the door, we're able to make referrals to the federal government, and they can go to your tax filings, a number of other things. I'm happy to get you the full list. But the federal government's going to get their money back from you if you are overpaid and don't have a way for us to recoup it.
Okay, that's great to hear. I mean, that's great to hear. I guess, there's probably I don't want to say this wrong, like ignorantly doing it not nefariously or whatever, but they're still going to have to pay that back regardless.
That's correct.
If it was actual fraud, do you prove that fraud? If someone intentionally filed and intentionally left out members of their family or something, is there any other ramification for that?
If there's suspected fraud, we would make a referral to the OIG, and they would go through their processes of determining if there was errors, making referrals to the appropriate law enforcement agencies. Even our frontline staff, we have what's called a fee, a front-end eligibility referral. And so even if that initial application, that first pass in the door, things just aren't feeling right or just not smelling right to our staff, they have, and they do, make that fee referral over to the OIG and say, we believe that there's suspected fraud here. We want you to look into it. And then it goes into the OIG's processes.
Okay, and switching gears slightly with the responsibility from 50% to 75% of the admin costs, is that going to take, as far as administrative costs, is that going to cost the state more? Where does that money exactly come from within your department?
It comes, yes, it's state GF that it'll count against. And so I'll use a great example. The $30 million that was appropriated by the legislature this year, that's $30 million gross. It's $15 million GF because we're under that 50-50 split. If we were to be having the same conversation after that change takes place to 75-25, that state GF share would be 75% of the cost, and the feds would only pay 25%.
Mm-hmm. And so like the 17 million or 16 million, whatever that was spent on the website, the bridge website, is that administrative cost or is that something different?
It would be administrative. It'd be under our tech bucket. But I think, I'll follow up with you to be sure, it would still be under that same matching levels. The same way that if it's being done under the Medicaid match, it goes 90-10. So if it's on the tech side, again, I want to go back and confirm, but my understanding is that it was 50-50 now, it would shift to 75-25.
Okay, I appreciate it. I have millions of questions, but you did state that 1/3 of all the offices account for 100% of, or all of, you use the
Nearly,
word, all of the errors.
Nearly, yes.
And so that is the focus. Is there something that's being done? Is it just purely that's not the amount of applicants? Because there would be errors in these other 60-some offices. What is that secret sauce? Are you guys looking at that then? I'm assuming you are.
We are, yes. And like I said earlier, it's just in terms of the resources that we have, where we're going to deploy them, how we're going to deploy them, what the interventions look like. We want them to be targeted where we know the need and the risk is the greatest. And so by taking that time on the front end to go through that processing or that quantitative exercise of identifying where the errors take place, we're going to be able to deploy those supports more strategically.
Okay, and I love the incentive. I wrote that down as well, that incentive. A lot more questions, but I'll turn it back to you, Chair. Thank you, sir.
We can go out, hang out anytime you want, Rep.
Thank you, Representative Bruck. On that, could we get a list of those areas, the 32 counties that seem to continues to be an issue there?
Sure.
Thank you for that. Representative Menser.
Thank you, Chair. And I want to thank you for the very informative and clear presentation. It's answered a lot of questions. And Representative Bruck asked a couple of the questions that, I was going to ask. But I just wanted to clarify, the majority of the errors are due to incorrect, incomplete information or a misunderstanding of the information and not on either the part of the recipient or the staff, and it's not necessarily fraud.
That's correct.
Thank you.
Thank you, ma'am.
Representative Cara.
Thank you, Mr. Chair. To the chair's question about those 32 counties, can we see the names of those 32 counties and then not just the volume of errors, but the percentage of errors, the error rate?
Sure.
Can you break down all of those details?
Happy to.
Awesome. Thank you.
Happy to. If you wanted breakdowns of by zip code, how many SNAP recipients are in your communities, by county, whatever, I mean,
I think the most
happy to.
thorough way you can give it to us, the better, so,
Sure.
I mean, without being, overly burdensome.
Sure.
But definitely by county would be very of interest.
Sure.
And with the 9.53% of error rate from 2024, how many of those were overpayments and how many of them were underpayments?
That's a good question. I know that I can get that for you. But I would hate to speculate and have you feel like I'm misleading you. So I'm happy to tell you which ones are over, which ones are under.
Okay, is it more over or more under, do you know?
I would expect that more of them would be over as opposed to under.
Okay. And then another question I have is, are there asset limitations for SNAP eligibility in Michigan?
The short answer is it depends on a lot of things. And so the legislature in the last couple of years got rid of the asset test that we have on the FAP side of things, right? So it was many years ago where it began. There's still some requirements on the federal side of things. But even absent the requirements on an assets for FAP benefits, you've got other requirements on Medicaid side or some of the other benefit programs that we have. And so I don't know if that answers your question or not.
But if they're just receiving SNAP and they're not receiving something else, should an individual who has a second house, $1 million lake house, be eligible for SNAP benefits?
If you want to apply for SNAP benefits, this is actually good. It gives me a chance to explain the process. You have what's known as a maximum household allotment for households, 0, 1, 2, 3, 4, 5, whatever the number may be. The maximum household allotment is the most amount of money that you can receive in a household of that size. We then, for example, receive your application. We look at what your net income is. And so you report to us your income. We take a look at your deductions. It could be childcare. It could be utilities. It could be that mortgage or housing expense. And then we subtract those deductions from your income. That gives us your net income. The federal guidelines tell us multiply that net income by 0.3 to identify what 30% of your net income is. Subtract that number from the maximum household allotment for your group size. That is the amount of food benefit that you would receive. And so perhaps to play out the example that you've just provided, if an individual has an income level that's high enough that 30% of that income level is greater than the maximum benefit that you could receive for that month, you would receive 0 benefits.
Okay, but in a different scenario, let's say somebody was born with a silver spoon in their mouth. They have a second lake house worth them $2 million. They don't have income, but they have all these assets. Would they be eligible?
If we went through the processing and they were determined eligible because their income versus their deductions provided for it, they would be eligible. But I find that hard to believe that in the scenario that you've provided that would be the case. If your question's on assets, Rep, I'm happy to go back and get some
But
additional
since
detail for you on
2023,
it.
we haven't had the asset limitations for SNAP.
That's my understanding, yes.
Thank you.
Thank you. One of the things that I want to focus on here and is the quote-unquote fudge factor that we've heard, and that is this. The issue that was brought up prior hearing was that we started calling the fudge factor was SNAP benefits, and it was explained to us that the current threshold is that payment error does not go to SNAP error rate unless the payment was off by $57 or more. Meaning MDHHS could be $56 off with every single SNAP payment every single time and still have a 0% error rate at the end of the year. So I'm concerned about that, especially when you take the 1.4 million people on these benefits and times that by that dollar amount. I mean, it could be $83 million. So I guess, can you confirm the existence of this so-called fudge factor? And I guess we'll start there.
Yeah, there is an allowance for if errors are under a certain size. I think we've presented on it in our OIG presentation in the past. Again, that's a federal regulation and a federal number that said it's not something that DHHS unilaterally came up with and deploys.
Yeah. So Do you train your benefit specialists to only look for payments that are above the threshold, or do they review payments for accuracy down to the dollar rather than ones that are $57 or more?
We train them to look down to the dollar.
Okay, great. And do you think that the acceptance of being $56 wrong with every payment and that being okay has impacted the culture of our benefit specialist at MDHHS?
I don't believe that it's impacted the culture of our staff, no.
Okay.
And if you're interested in changing it, I would refer you to the federal government, sir.
Okay. In other words, do you think there could be some wiggle room, results in every case not being reviewed stringently and accuracy based on that $57?
I mean, we want to be accurate down to the dollar. I mean, and that's what we're driving towards with the effort that we've come in here to talk about today. And so, recognizing that it might be clear and concise if it's a 1 or 2 person household, they get their paycheck every 2 weeks, it's all clearly delineated on the stub. Yeah, that's a relatively easy case to process. But there are a number of individuals that we serve with varying degrees of life circumstances and resources and are struggling to make things meet. And so we want to be accurate, we want to be timely, and that's what we're going to stay focused on in pursuit of this lower payment error rate.
Great, thank you. And I know that in our previous hearings, I believe in the first one, that we had brought up the website. And that website, I believe, was around $16.8 million. And at the beginning, you had talked about the requirements, the minimum requirements of the federal government. And I believe in that hearing, it was the governor's address with a fake name. Didn't need to put in a alien number or social security number. And all at the beginning, I was told how great the website is, and then towards the end, it said they mentioned, well, we catch this on the back end. And so this isn't a gotcha. I mean, this is a real concern of mine, and obviously taxpayers in this committee, and I'm sure you, is what in the heck are we paying for a $16.8 million website if all we're asking people to put in on the front end is their name and address? I mean, that's a statement, but it's also a question. Like, you personally, I guess, why would we invest in that money for something? And lastly, the federal government, those are the minimums. You have the ability to put in some other safeguards. So my other question is why would we not, for the sake of you and your team, put in at the beginning mandatory alien number, social security number, proof of income, so that we could actually utilize that $16.8 million resource and then make things easier on the back end for your people? Could you answer those?
Yeah, I'll try to get to, I think, what you're getting to. And let me be clear, Rep. I'm frustrated by technology too, and the pace at which things change, how it operates. My staff will tell you that I constantly bring up when we talk about our staff deployment and processing error rates and how we can do things in a more efficient and effective manner. The example I constantly bring up is, we have our systems that are running throughout the course of the day. Our staff are processing applications. Why don't we run a second shift? Why don't we run a third shift? If somebody wants to do that work from midnight to 8 a.m., why not do it? We have a batch processing system, and so every single night the system has to take a nap, I like to say, and process all those applications and get things out the door. And so there's technical limitations to some of the things that we can do in terms of how big and how bold that I would like to go with some things. But in general, the money that we're spending on My Bridges and Bridges, there's things that I think we can add along the way to prompt individuals and to help them understand what we need and when we need it. My Bridges is, of course, the public-facing portal. Bridges is the portal on the back end with all the data and all the calculations, storing all the documentation. And so I'm always interested in making technological improvements. Like I said earlier, we've identified 30 of them that we want to do just coming out of this exercise that we've completed, 10 that we want to do in the immediate here and now. And to the extent that we can, and we have talked about this, If the federal government says I can't require it, it doesn't mean I shouldn't pose the question. And it doesn't mean that I shouldn't provide the prompt. And so we call them nudges. What are the nudges that we're going to be able to provide within that application that says, yes, you might only need to give me your name and your address and your signature to hit send, but you're not going to get any benefits by doing that. We need all of this other additional information. And so if you want to get it processed, you want to get it processed quickly, and we want to process it accurately, we're talking about and looking into what are those nudges that we're building in along the way to help folks understand what we need and why we need it.
Great, thank you for that. And, you know, I know that the federal government portion says that you can add anything you want as long as it's not discriminatory. So I don't see why that shouldn't be something that we immediately look at doing, of asking people for an alien number, a social security number, some of those things. To me, I think that would save a lot of time and even help with that self-attestation portion that we know, even by the OIG reports, there is fraud there. And so I would like to see that done. And, you know, obviously we're working with Secretary Kennedy and his team on the federal level. I'm sure that we could get together, and I don't think that would be at all a bad thing to do. I think it would be great. So thank you for that. Representative Bruck.
Thank you again, Mr. Chair. You had mentioned regarding the error rate that the non-participants on the phone QC count as an error, and you said that was a percentage. Do you have an approximate percentage of the errors that would be caused by non-participation?
Off the top of my head, I don't, but I can get you that full breakdown. Happy to. Yeah.
But it happens more often than probably wanted, I'm assuming.
More often than I'd like, that's for sure. Yeah.
Yeah. No, I appreciate the in-depth, again, echoing what other committee members have said, the in-depth investigation, if you will, that you guys have done in identifying those areas that you really need to focus on. And then just asking for a friend. SNAP and Bridge. Bridge card, SNAP card.
Same thing.
They're the same thing.
Yeah,
Okay.
same thing.
Okay. Alrighty. And with the federal government reopening, thank God, they finally did their job in Washington. But in the last, beginning portion, first half of this month, you did not receive that federal SNAP benefit. We did the state weekly benefit. Can you just kind of go through it? Have you guys come short in any area because of that? Did what we do here at the state level help you guys? And is there any difficulty in, I don't want to say reopening because you never closed,
Sure.
but with the federal government now getting their gears rolling?
First and foremost, Rep, I'm going to be looking to see what guidance USDA sends out to us today. I would anticipate something comes today. I had texted my staff before I walked in here. If USDA sends us something, please tell me, because I think I'm going to get asked about it. We haven't received anything yet. But as we're sitting here today, you're correct. The president signed the legislation last night, reopening the government. That provides for backdating to October 1 of this year for the SNAP benefits and funds the SNAP program USDA for the balance of fiscal year 26. So as we sit here today, I don't anticipate any issues or questions. There's obviously litigation at varying levels that we're watching closely and considering thoughtfully as we make our decisions moving forward.
Thank you very much.
Thank you, sir.
Thank you, Chair.
Representative Caro.
Thank you, Mr. Chair. You mentioned earlier that if somebody has a change in their income, they have 10 days to report. And using your example you had earlier about $150 in payment, and if they were to have that change and it was supposed to be $100, then the next month you just give them $50 to
Correct.
calibrate that number. I guess my question I'd have with that first is if it was $100, that's only a $50 difference, so that would not count against your error rate. But if, say, it was $90, so it's a $60 difference, then that would count against your error rate. Is that correct?
Correct.
And would that count against the error rate for like a 1 out of 1 for that 1 month, and that individual is counted as a complete error? Or is it counted as like 1 out of 12 because 11 of the months you were correct on, but 1 of the month you were not? So are you batting 0%? Are you batting 11 out of 12? What is it?
It's a great question. Yeah, so that monthly randomized sample pool is simply for the benefit that was issued in that month. And so if they determine an error took place on one of those cases, they look at the percentage or the number of dollars that were over or under issued, and those that were done in error, and that's used to calculate the error for that month. So it's not like we identify an error in the month of October and then we extrapolate that out over the course of 12 months. We're looking at that randomized sample for that singular month. When you go to the subsequent months, you're looking at an entirely different randomized sample.
Okay, thank you. And then another question I have on the presentation you had, you said for every $1 in SNAP benefits, it leads to $1.54 in economic impact. I know you said that it can save money, in the future with healthcare costs or, helping to stimulate the economy, whether agricultural or grocery purchases. The economic analysis that was done for this, was this done by a Keynesian economist, Austrian economist? What type of economic model was used?
That data point comes from the U.S. Department of Agriculture. I can't speak to.
Are their economists good?
I would point you to the USDA to ask that question.
Okay, yeah, I think a conversation with them would be productive because I think there's a lot of people who make claims who don't have a good economic theory to back up the things that they say. And my last question is, what is MDHHS doing to communicate with the federal government to make sure that we're doing our process properly?
As it relates to the interventions we're looking at now, or what
Yes.
specifically? I mean, we're communicating with USDA. I mean, FNS, part of USDA, they have their regional offices. We talk with these individuals on a daily basis. We've talked to them about 5 times a day for the last couple weeks here. And so they're aware of our effort. There's also a multitude of associations across the country because, as you know, Michigan's not the only state that's looking at this issue. And so whether it's coordinating with FNS, whether it's coordinating with other states, identifying those best practices, and then deploying them across the country, that's happening on a daily, weekly, monthly basis.
Okay, thank you.
Well, thank you for being here today and answering some of these questions. I guess probably the last question that I have for you is, what's your 5th general order?
Oh, gosh.
To quit.
I don't have it. It's been too long.
It's okay.
That's not fair, Rep.
No,
Come on.
I know. I'm having fun. So it's probably the only one that I remember anyway.
Well, what is it? What is it
To
then?
quit my post only when properly relieved.
God bless you.
Anyway, thank you for being here today and answering some of our questions. Thanks for your testimony and your willingness to be here. I do want to say, and I mean this very respectfully, when Director Hertel came before our committee, she said that she was communicating with the federal government. I have emails and personal conversations with the federal government saying that that's not true. So if you and Director Hertel would like to come to my office, we can do a Zoom call and we can get this thing put to bed and get this fixed. I would ask also in closing that you take very serious looking at the alien number, Social Security number, and beefing up that $16.8 million investment that our taxpayers have paid for and utilizing it to its best ability. And I do truly appreciate you and your team in being here and coming on your own accord. So with that said, Representative Brock moves to excuse absent members, which we have none.
Yep.
So hearing no objection, I guess we're good with that. But there being no further business before the committee, the meeting stands adjourned.